My name's Trent Hummel. I'm a pediatric neuro-oncologist at Cincinnati Children's Hospital. I'm also a member of the board of directors of the Cure Starts Now Foundation.
And I'm Keith Desrick. I am chairman and co-founder of the Cure Starts Now. I know with my daughter, we went through radiation initially, and we went through it pretty quickly, and I know that's something you feel strongly about as well.
Right, because radiation is standard of care for DIPG, and one of the things that sometimes we see, and it does get to me, is families may be looking for that one right thing or the next best thing to do, and they delay radiation, or they're getting multiple opinions and they're delaying radiation. And in some kids that may be appropriate, but oftentimes you're presenting to the hospital with those neurological signs and symptoms that led to getting an MRI and led to the diagnosis, and those will only continue to get worse, even with the steroids that most likely you're going to be on. And so getting that radiation started is key. So that's why it's important to build a team, like Keith is saying, to have someone else look ahead while you can focus on your child and get that ball rolling on the radiation, and while you're also looking at other potential trial options down the road.
Well, and certainly you're going to defer to your doctor, okay?
Mm-hmm.
And you're going to defer to that second opinion, and we wouldn't ever suggest that you do anything
Absolutely.
else other than that. But at the end of the day, with it, radiation is the only thing that we've seen that really has a dent in it at this point.
Correct.
And so that's why it's important that you want to seriously consider that, and time really does become a little bit at the essence. Once you get past radiation, you need to really know what type of trial you're going to be on or what type of next decisions you're going to be making. And you have some time to deal with that.
Mm-hmm.
Radiation is going to take you some time, maybe 3 to 5 weeks.
It's about 6 weeks or so.
So that's when you really need to be ready to go to the next step of it. But unfortunately, radiation, for the most part and for most patients, is kind of a temporary fix.
Correct. Yep.
And we start to see some of those symptoms start to come back, which is the reason why we suggest that you look at other options, but it's also the reason why we do what we do, because what Cure Starts Now is trying to do is also trying to fund that next step and to try to give us all some options.
Absolutely.